Good morning, everybody. This is Dr. Jeff Culbert, Schooley's Mountain Chiropractic Center, your leader in alternative healthcare. And I hope you're noticing today that I am in a blue shirt. I own more than just purple shirts because today is a Thursday. And in our office, Thursdays is a blue-colored day. So you'll start to get a sense and a feel for what we're doing here in the office based on the color shirt that I am wearing. But today we're going to do a little bit of interview with a patient of ours. His name is Steve. And then we're going to go from the little bit of an interview with Steve off into an adjusting room and give you a little bit more of a flavor for what we do with Applied Kinesiology and how we adjust here at Schooley's Mountain Chiropractic Center. So hopefully you'll find this information helpful and useful, and that you'll hit like and subscribe to increase our membership so you find it easier on YouTube to find us and our videos. And if you want, you can also visit our website, smcc4u.com. Leave us any comments, send us an email, call the office, schedule an appointment. So without any further ado, I'd like to introduce Steve. Steve's been a patient here for a couple of years now. He has a lower back degenerative condition. He's also a phenomenal drummer that periodically his shoulders start to flare up and get a little agitated. So I'm going to give Steve an opportunity to tell you guys a little bit about Schooley's Mountain Chiropractic Center, what makes us a little bit unique, and what his experience has been here at the center.
Sure. Thank you, Doctor. Appreciate it. Every time I come here, it's because something is going on, and I know that's against doctor's wishes. He wants me to be on a maintenance thing, but I live a little far away. But I have to say, every time that I come here, he's able to solve my lower back problems, and I do a lot of lifting when it comes to drumming. We do our own sound and in and out, so it's not just me sitting at the kit and playing. There's a lot of physical stuff that comes with it. Plus, I do a lot of Peloton and mountain bike riding too. So Dr. Jeff is gentle yet firm when it comes to my treatments, and I've never left here, in any pain in any way, shape, or form. And sometimes he says it's a little too good because I wait a little bit too long to come back, but either way, it's time again, and this is a fantastic place to come. The staff is wonderful, and just thank you for all the work you've done on me. I really appreciate it. It's necessary.
You're welcome. And as Steve referenced, I really would love to have him come back more frequently, so not only can we relieve the pain, but get it corrected, and then set him up on a long-term wellness program. But at least Steve is smart enough to know that he's got a lifestyle. He's got stuff that's going on. I appreciate the distance that he has to travel to get here, which means he obviously values the services that we provide, and that I'm smart enough to know that if he appreciates chiropractic to the level that he needs it and I can deliver it, we're more than welcome to have him here, and we work together as a great team, because it is my input, his doing what he needs to do, that gives him the results that allows him to speak so highly of the clinic. So without any further ado, we're going to move this from the sofa into the adjusting room. Okay, so here we are in the adjusting room, Dr. Jeff and Steve, and I'm going to take care of Steve, and I'm going to start from the bottom of the feet right to the top of the head. We use a technique in the office called Applied Kinesiology. We'll be doing a lot of diversified adjusting with Steve, some flexion distraction, and get his extremities adjusted as well, obviously to take care of his shoulders. As a drummer, he needs his arms and upper extremities as well as his feet to hit the pedals, and he's got to sit, and with a little bit of a degenerative disc, we want to make sure that's wide and open so that he's sitting and playing as comfortably as he possibly can. So again, Steve, we're just going to go through some basic AK stuff, muscle testing. You've been through this before. So we're going to start off with, just hold your arm up for me, Steve. Excellent. And I'm just going to start by checking Steve's SI joints. And he's got a little bit of a weakness, so I know that there's a left SI joint going on the left-hand side. We're just going to continue to muscle test and check right on down. We got a little bit of a knee issue going on. We'll take care of that. And knee often results into foot or ankle going on, so we know we've got an ankle, a knee, and an SI joint with Steve. Then we're going to check some things that I call internals. I'm going to reprimand Steve about not drinking enough water, maybe being a little bit overstressed. But, we're just checking things that are there on the AK and the acupuncture system. So right now I'm checking sinuses and drainage. We got a little bit of sinus going on. I'm checking cranial faults, because oftentimes pelvis goes with cranial faults. There's a little bit of a neck issue going on in the mid-neck, both sides. Steve just got back from Montana, so I'm going to assume he's a little bit tired because his tired bone is also a little bit out. Hold here, I'm pushing down, Steve. Right shoulder looks really well and engaged. We're going to come and challenge the left shoulder. Hold on, pushing down. Left shoulder's got a little bit of a tweak to it. We're going to take care of that. And then I'm just going to double check the lower back issues. Slight little bit on the right side lower back. Oh, we got a big spot. What you do in Montana? That left side lower back. Climbed a mountain, I'm sure.
Actually, jogged for the first time in a long time. That might have something to do with it.
Okay. Jogging at altitude, I've done. It's never a fun thing.
That was not fun. I shouldn't have done it, actually.
So we're going to start off by blocking the pelvis. Again, with all of my patients, we go through and do a little bit of, Goldilocks theory. Are what we're doing too soft, too hard, just right? I use 6 different techniques in the office, so generally every patient gets a little bit of everything. So the SOT blocks help to balance the pelvis a little bit for us. Then I'm going to go in and I'm going to use my activator, which you guys have seen in other videos. And we're going to adjust the knee. And we're going to adjust the talus and the cuboid. And then we're going to come on in and we're just going to give a global extremity adjustment to the lower extremity. Then I'm going to come in while he's resting on the blocks. I'm going to work some kidney acupuncture points because the water points showed up a little bit off. And obviously if you're out in altitude, it's incumbent to drink a lot. You're traveling on an airplane back and forth, need to drink a lot. I do happen to know that Steve has been under some personal stress, so the acupuncture stress points are a little bit off. The other thing that you're going to start to notice when the adrenal glands are pooped out and you're overstressed, one of the reactions that occurs from that is that your ligament strength starts to shut down. So with Steve having things going on from his ankle to his knee to the pelvis, the little bit of the left shoulder, the neck, the sinus, I can bet you bottom dollar he would agree that stress will cause your body to want to start to slip and slide out a little bit. What do you think,
Yeah,
Steve?
absolutely. 100%.
So we're working the adrenals. We're going to come through and just work the sinus points a little bit for Steve. So one of the things you should be picking up pretty easy on is that while Steve may be coming in for a lower back or a shoulder issue, we will be taking care of his full body in this adjustment, because the area that is broken or breaking down or having a little bit of a challenge is supported by other areas that are going to need to have themselves kind of fine-tuned and picked up a little bit. So we're going to come in now, we're going to adjust Steve's neck. And Steve, you're going to relax for me. There's 1. Relax again. 2. And then we're going to get 3. There we go. Now, from there we're going to start to take away the blocks. Move the activator a little bit. And then I'm going to ask Steve to lay on his side for me, this way facing over here. And the bottom leg is straight, Steve. Thank you. And we're going to take these arms and move them. And you're going to relax for me. Oh. There you go. And face the other side. We knew that left side lower back was a little bit locked up, did we not? One. Okay. Again, bottom leg is straight, Steve. There we go. And again, you're going to breathe in and breathe all the way out. There you go. Not quite as loud as the other side. Can I have you sit up for a moment? We're going to get your shoulder. Oh, you're going to go that way? I'll go this way.
Where do you want me?
You go that way. Now, again, we're going to slightly, there you go. Thank you. We're going to recheck that. Hold your arm up for me, Steve. I'm pushing down. Excellent. Let's have you turn down onto your stomach for me, Steve. There we go. Now again, as we come through, we're just going to do a quick little leg check. Legs are even now in position 1. They drop way down in position 2 there. So that's going to be that pressure on the lower disc, for which we're going to traction out the lower back a little bit. Again, a gentler technique, but it helps to open up the disc space and the facet joints and start to loosen that up a little bit. Now, Steve, I'm not tractioning too hard or too fast, am I?
No.
Excellent. The key with this traction is to open up, but not go so fast and not go so deep that it actually, those small little muscles around the facet joints or the joints that guide motion start to stretch and pull a little bit. Then we're going to come on in with the activator and just give a little impulse to help loosen and open up those facet joints. And then along with that, we're going to do a little respiratory technique. Steve, you're going to take a deep breath in. Breathe all the way out. Breathe in and breathe out. Breathe in and breathe out. And breathe in and breathe out. Excellent. And then while Steve's stretching, we're going to come back. We're going to double check those leg lengths. Position 1 is still even, and now position 2, those leg lengths have leveled out really nicely for us. I'm going to ask Steve to let his arms drop by the side, and then we're going to ask Steve to take a deep breath in. Breathe all the way out, Steve, all the way. There you go, beautiful, thank you. Now that area of the middle back, it relates to stomach stress and slouching. So with the stress that Steve's been under and the traveling, I'm going to assume it's at least a little bit of stress and a little bit of slouching. And then proverbially the tired bone sits here at the base of the neck. So we're going to just adjust that with the activator. We're going to give him a little bit of traction in a moment for that area, just like we did for the lower back. And the nice thing with the table that we're utilizing, it allows me to traction both the cervical spine as well as the lower back. And if Steve happened to be pregnant, we could drop the center section of the table so that we can get a rather large or a belly with a baby or somebody who's very big and overweight onto the table and into a position that will be able to traction their lower back without jamming or irritating the back. So again, we traction out here for a little bit. And as you can see, while Steve came in with a left shoulder and a lower back, we've adjusted the ankle, the knee, the hip, the pelvis, the low back, the mid back, the left shoulder, the neck, tractioned out. Check the acupuncture system for some internal organs, his immune system for drainage. And so you can see that in a rather short period of time here at Schooley's Mountain Chiropractic Center, we cover the entire body. We like to think not only we're a full spine adjuster, but we're a full body adjuster, rendering the best and finest of health care to our patients, keeping them hopefully away from medical doctors and pharmaceutical type of products, but when they are needed, we'll make the appropriate referral. So that is our adjustment of Steve and what typically happens at Schooley's Mountain Chiropractic Center with the kind of varied, unique, eclectic adjusting style that we use. So in the future, if you happen to be out in Pennsylvania at a bar and you happen to hear this guy playing, big round of applause. And that when he makes it famous as a drummer and he's receiving his country music award, or hopefully you're going to hear Schooley's Mountain Chiropractic Center. Thank you, Doc, for keeping me playing.
Absolutely.
In the meantime, you guys have a great day. Again, hit like, hit subscribe, visit our website, and we'll see you in future videos.